Good afternoon. This public hearing is called to order. Today's date is July 27, 2017, and the time is now at 2:12 p.m. The hearing is scheduled to take place between 2 and 4 p.m. this afternoon. I'm Diana Zalf, Associate General Counsel with the New York City Department of Health and Mental Hygiene, and with me is Rima Oken, who's with our Division of Disease Control. And also with me is Svetlana Burdenik, who's our assistant to the Secretary to the Board of Health. The purpose of today's hearing is to elicit comments to assist the Board of Health in making a determination about a proposal to amend Article 13 of the New York City Health Code in regard to testing for hepatitis C. A notice of intention to amend this article was published in the New York City Record on June 22 of this year. A copy of the first page of the notice has been provided to the reporter to include in the record of this hearing. People wishing to speak today were offered the opportunity to pre-register. People who didn't pre-register are also able to register right now. Is anybody here today who wishes to make a statement about this proposal? All right, why don't you come up to the microphone and introduce yourself and state your affiliation for the record.
Hello.
Hi.
Hi, my name is Tatiana Vera. I'm coming with the rest of our hepatitis C peer educators from Montefiore Medical Center. My specific role in total is considered hepatitis C program supervisor, but I also act as patient navigator to our current hepatitis C population patients, linkage to care coordinator, and health educator. So it kind of encompasses all of those things. And so when we were reading about this specific public hearing, I thought that it was very interesting because I completely supported the methadone clinics that we work out of in the Division of Substance Abuse. They, I think within the past year, have implemented it that if an antibody test is to be done, the reflex for the viral load or the RNA test will also be conducted. And as the point person who does and completes all of the prior authorizations, that's made the process extremely easy. We've had patients who had been on our at our 3 different methadone clinics for years and years and years, and they only had a reactive antibody on their system. So for us, that can mean a multiple amount of things. If they don't have their primary care with us, we're not sure if they got treated somewhere else. We don't know if it was an acute infection and it went away. So for our new patients who are now getting intaken, I guess, for the new methadone programs, we can actually have a confirmation now, like, yes, this patient does in fact have hepatitis C. We see this viral load. We can wait if we're unsure, like if it's a low viral load, we can wait a couple of months, but these things are now being reflexed, and that makes my job a lot more simpler because it lets me focus in on the patients who need it, rather than patients who may have cleared it themselves or may not for some reason remember that they took the medication at some point. So I would like to firmly agree with the stance that the RNA testing should be reflexed and also mandatory statewide, because I think if it's helped us a lot, it can help a lot of other clinics who may not be as established as Montefiore's methadone sites are. That's what I wanted to say.
Thank you very much. We appreciate your comments.
Thank you very much.
Yes, sir, would you like to speak?
Me?
Yeah. Oh, you got to
No, I'm gonna stand right here. I'm good.
That's okay. That's okay. If you would please,
Never mind.
No.
if you would please start by saying your name
My name is
and
Gilbert Cassell.
your
I
connection
am
with
one
this
of the peer
program.
counselors at Montefiore, and my biggest concern is that when people come in to get checkups, that I think it would be in their best interest to be tested right now or offered to be tested, because if my doctor hadn't taken the initiative to test me, I would have never known that I had Hep C. And at graduation, I said that early detection is the best detection, because within 8 weeks, with the help of the Harboni, I was undetectable. But I couldn't understand, how did I get it? It's been like 25 years since I have been an addict. So, and we know through studies that the virus can stay in your body dormant 10 to 20 years. So I'm talking 66 years later, So he asked me when was I born, and I told him 1950, and he said, bingo. I said, being what? He said, you're a baby boomer. So anybody born between the 40s and 65 is a baby boomer. And unfortunately, when the soldiers came back, they blessed, not all, but some of their offsprings with it. So that's my beef, is that they should be automatically at least asked, have they ever been, or would they like to be tested? I'm clear.
Thank you very, very much for your comment and for sharing your experiences. Is there anyone else who would like to speak? Okay, well, there being no further speakers, we're going to adjourn the hearing at this time. We'll reopen at the hearing at 3:55 p.m. just to see if anyone else has showed up who'd like to speak. Most likely not, but we'll see what transpires at that time. Thank you very, very much. This hearing is now adjourned. Okay, hello. We have one more speaker who wishes to make comments, so this hearing is now reopened for that purpose. The time is now 2:33 p.m. Please state your name and affiliation for the record.
Yes, my name is Alan Chung. I'm the patient navigator working in a hospital in Queens, and especially working for hepatitis B, hepatitis C patient. So when I hear there's a new change about the screening to request the mandatory reflex RNA for hep C antibody patients result, I feel it's a very wonderful thing because in our hospital, we start doing some initiative to increase hep C screening, and we found we don't have the automatic or mandatory order for the RNA test. So when we saw antibody positive patient, sometimes we will miss them because a lot of our patients, the location of our hospital, there are a lot of new immigrants. So when they got an antibody positive test result, and it's kind of difficult for us to find who they are and try to call them back to the hospital to get another chance to do second round. So, and I think this change will be very important, especially a lot of our provider mentioned this is very important to our lab, but sometimes they will have different opinion from the financial part or from the policy part, so it's kind of difficult, but if we have this change, I believe it would be benefit for the community, for the provider, and also for the hep C, because that's the important part to really find the patient and to provide assets or provide help to those patients.
Well, thank you very much for your comments. We really appreciate them.
Thank you very much.
Okay, the time now is 2:36 p.m. This hearing is now adjourned to 3:55. Thank you. Hi, we're back on the record. The time is now 3:59 p.m. Nobody else having appeared who wishes to speak. This hearing is now closed. Thank you.